Yeah, well, today I had the privilege of chairing a session on nutrition and cancer in low and middle income countries, and we won that session, and it was great because I wanted to get more attention on nutrition and cancer in these parts of the world, because we tend to say, okay, the risk factors that we know for high income countries are similar to those of low and middle income countries, and that's definitely not always true. And so we need to do far more research on that to be sure that what we are recommending to prevent cancer in high income countries are the same recommendations that we also should give in low middle income countries. That's why we needed that workshop. I'm very glad that we had the opportunity to do that today. Well, the thing, let's talk first about similarities. What we see is that their risk of what we call Western types of cancer, that's breast cancer, colorectal cancer, prostate cancer, are alarmingly increasing in these regions of the world. And actually we don't know what the causes are in those parts of the world. And we know that overweight, for instance, is a huge risk factor in Western types of cancer, but we don't know whether that's actually the same in those regions. But what we do see is that they have a huge transition in dietary habits, in physical activity habits, and especially a huge increase in obesity and overweight. And if that's also causing their increase in breast cancer and colorectal cancer and prostate cancer, then we definitely have to do something about that. But interestingly, in Africa, for instance, we see that women tend to have a lower age at which the cancer is diagnosed. And the question is that the same type of cancer that we see in Western countries, or are these more premenopausal type of breast cancer, which may be different and also may have different risk factors? So that's what we're focusing on, and that's also what we need to focus on for the coming decades. I'm not, as I am really working in high income countries, and that's why I gathered around a couple of women from the International Agency for Cancer Research in Lyon, IARC, and a colleague of mine from the University of Fes in Morocco. And they are working on nutrition and cancer in developing countries, and I've learned a lot from them. And knowing also that we need the experience from researchers like me working in high income countries, but we have to translate that now to research in those areas. And it's not as easy as it seems, because there's not the traditional infrastructure of doing these types of research. And we also need to train researchers to be able to do that type of research and to know about nutrition and cancer. That's also why we decided to make a massive online course on nutrition and cancer specifically for training people who are not yet trained in nutrition and cancer, but also for policymakers, politicians, health professionals, to be able to know more about this topic, because it's really necessary. Yes, I was really pleased with the turnout in our workshop. We had about 150 people coming, and what I saw were they were all from different regions of the world, and there were a lot of people engaging in the discussion, also from Vietnam, from Nigeria, from Tanzania, from England, from everywhere. So that was really good, and that's why indeed this World Cancer Congress is so valuable. It will open tomorrow on edX, and There are already 3,000 people subscribed, so I really hope it's going to be massive. We are also organizing a masterclass on nutrition and cancer in February for PhDs and postdocs. So these are people already advanced in the field. And for instance, the new director of IARC will give a talk about future perspectives on nutrition and cancer research. That's very helpful, and there will be many international speakers who give this course, which is a small course, only 30 participants, but it gives also it has the ability to sort of interact with one another and really work together. We know what the risk factors for cancers which are common are. And then I'm talking about breast cancer, colorectal cancer, prostate cancer, and lung cancer. And we know that these types of cancer are related to what we do ourselves. So it's how much we exercise. It is whether we have a healthy diet and whether we smoke or not, which is associated with about 30 to 40% of these common cancers in the world. And what I've noticed is that a lot of people do not really know what a healthy diet is, for instance. Exercise, okay, smoking they know, but a healthy diet, what is a healthy diet? And a healthy diet is a diet which is not too high in energy compared to what you do, what your exercise is like. So it should not increase your levels of being overweight and obese. So it should be not too energy dense, but it should contain the right things. And therefore we say, okay, eat a lot of vegetables and fruits, a variety of vegetables and fruits, so much that you have about 2/3 of your plate would be plant foods. Then we ask people to reduce their red meat intake. Red meat is meat that looks red when you buy it, when it's raw. So beef and pork is red meat, and you should reduce your consumption to about 300 to 500 grams a week. Then what you definitely should reduce your alcohol intake. Alcohol is the most carcinogenic compound in our diet. It's also containing a lot of calories, so also increasing the risk of being overweight. Those are the most important dietary factors that we should be dealing with. And it seems to be really difficult, because if you ask people whether they adhere to the recommendations for cancer prevention, only maybe 10% of people are able to adhere to those recommendations. So there's a lot of work to do. I think that a lot of people are opinionated where it comes to nutrition. A lot of people think that they know because it's common sense. It's something that people just can come up with themselves, but it takes years of scientific research to know what we now know. And so a lot of people are also, it's sort of a religion, really. Some people really know things and they feel things. But as a scientist, of course, I would say trust the scientific evidence.